Hello, my name is Stacy Gonzalez. I am Executive Director of Healthy Community of Brookfield. Today's presentation will focus on the goals of our organization, and that is to create a financial plan to ensure the organization is well funded, create a strategic plan to incorporate community and constituent partnership, establish standard operation procedures to ensure HCB retain its accreditation, create a learning environment for employees, and create ethical policies to stop the fraudulent financial mishandling of grants, local and state financial reports. Healthy Community Brookshire is a 501 non-for-profit charitable organization. HCB was a visiting nursing agency called Brookfield Health. Brookfield was the department in VNA contracted for the state. It managed intervention and prevention programs for cardiovascular disease. It promoted health programs initiatives in Brookfield County and the city of Tacoma School District until 1997, when a benefactor decided to donate $1 million to HCB to work on health promotion and wellness. Programs and services that HCB provides is in the areas of nutrition and education for teens, child care, women health and primary care, maternal and child care, mobile medical health services, management discharge services for the elderly, violence programs, smoking cessation classes, diabetes classes, after school programs for teens, wellness and fitness programs, and well water testing and water mitigation assistance, vaccine and immunization services. Be advised, according to the Director of Department of Health, we did not meet our qualifications, and therefore our accreditation is in the process of being deleted. Because we did not meet our accreditation, and the reasons for the fact we didn't meet our accreditation is based on certain factors. The staff at HCB views their work environment as a good place to work. Employees do not feel secure about their environment because we continually have a financial crisis that the organization continues to experience. And because of that, the staff has found it hard to internalize the mission and values of the organization. In regards to the political environment, we failure to meet our accreditation requirements. Constituents have no confidence in our organizational leadership because they say that we have no knowledge of the healthcare programs. That's because we're duplicating other healthcare programs by other healthcare organizations, and our leadership has become questionable due to the board of directors. Now, many of the board of directors do not have a background in public health, and because of that, they are seen as being incompetent. HBC Board of Directors are pressuring county officials for more money to push their own personal agendas that have nothing to do with our mission and vision for the organization. Local and state officials and farmers are frustrated by the Board of Directors. Counties are frustrated with the continued demands for money, frustrated with well water testing programs which they never receive but continue to get charged for. We continue to duplicate services by other organizations, and although the community sees that we're doing well and hard work and dedicated and knowledgeable, the community does not realize that HCB has failed to provide proper services. And as regards to economic forces, the programs are contingent upon grant funding and local and state aid. Because we did not meet accreditation, programs community support are now vulnerable to closure. And because HCD has no solid financial plan, we are looking at high debt, as well as losing our accreditation, and as well as maybe closing our doors soon. As you see, HCB does have a number of strengths that our organizations do possess. We do have a divine mission statement. We are a nonprofit organization that focuses on wellness and health development in our community. We are hardworking and knowledgeable, and we do have a staff that thinks it's a good place to stay. And we do invest in programs in regards to our medical staff to provide the community with good delivery of services. But our weakness is the fact that we do not have a strategic plan. Because we do not have a strategic plan, we have poor financial resources. Directors and managers focus more on seeking grants and funding on their personal programs, and we do not have the allocated money for other public programs because of that. We are seen as an organization without good leadership. The chief advisor We do have one, but he has not been able to budget the money to keep the organization and staff and programs afloat. And HCB is creating duplicate programs that are exceeding our funding, and they are unnecessary expenses. Basically, the opportunities that we have is that we do have a past relationship with constituents and the community. And because of that, we can use partnership as a way to create extra financial resources to create a learning environment, training for our organization and employees. Also, a partnership can help us foster a relationship with the community so they can adapt to the mission and values that we're trying to teach in regards to health and wellness. And also, by creating a strategic planning, we are staying within a coordination in accordance with the CDC's protocol, as well as expanding the mission and values of our organization to the public health community in order to maintain accreditation, establish long-term goals and relationships that will revitalize our organization's reputation and organization and make us a leader in the public health field. Now, the threat that we are facing is that the CDC regulations, public health organizations, rule says that we need to have a strategic plan in order to meet the public health needs of the community or face losing our accreditation. We lose our accreditation, we will not get financial and state aid. Because of the board members have misappropriated funds, we are in jeopardy of being audited, and if we are audited, we might be forced to pay back money. Thus, we might have, and will lead to layoffs and stop staff training. Also, failure of the leaders to create a strategic plan to reach out to public health organizations has caused us to duplicate other programs that is being done by other agencies, and also is causing us to have a over cost expenditure which we don't need. And also, the lack of partnership and misappropriation of funds and failure to create a strategic plan has jeopardized the ability of HCB to effectively deliver services to the community, as caused the organization will close its doors because HCB's lack of accountability and influence in with other public health organizations, which has created a deficit for us and also jeopardized our reputation because of misappropriation of funds. Now, the strategic plan here is to create a community and constituent program to bring about a health system that is structurally and economically improves the condition of the community, but also allows us to reach into the health sector of the community to find out what the needs of the community is in order to become more involved in the community and planning, designing, implementing, and evaluating appropriate programs. The 5-year plan also will include limited tenure of the board of members to 3 years. That way we don't have a conflict of interest. We're also going to incorporate disciplinary action against those that violate and do not comply with our rules and regulations. And also, by creating rules and regulations, it will help us to keep a better eye on our budget, keep a stronger infrastructure, as well as allow us to keep better partnerships with the community and constituents. And also encourage and train staff members to be healthcare advocates to replace our present leaders if they cannot do their job, and create operations of standards and procedures explaining responsibilities of duties of all staff. In a whole, the mission and vision of our organization has been to provide quality of care and promote health and wellness practices in order to change the behavior of the community by allowing them to change their behavior in regards to health, as from an individual community standpoint. But if we look overall at what our issues are, we need to create a strategic partnership with other health organizations. This needs to be our new mission. And by doing so, it will allow us to allocate extra funds to create a learning environment and create programs to teach populations to take care of their own health. Also, in regards to our visions, we can still keep the healthy behavior changes in regards to the individual community, but our aspirations should be to create interventions and preventions that are culturally competent. And by doing that, we will build a cultural avenue that will lead to cultural and generational changes as it pertains to the individual and community health. To establish the purpose and the goals of the organization, relationships, we need to create relationships with the population and communities that we engage, first and foremost. We also need to do an assessment of what the true triggers are in our infrastructure need to be changed. We need to, the assessment must be conduct the abilities of present leadership. We need to examine that. Examine the board engagement between the community and the constituent, and programs that are in place that are not being promoted by other health organizations we need to eliminate. The organization leaders must practice cultural competence. We must create community partnerships, allow communities to participate in creating intervention programs for themselves. Work with constituents to create long-term partnership to build on a capital budget for furnishing equipment, hire outside agencies to train our staff in order to explain them their duties and responsibilities, have ethical standards and regulations, and in order to create a surplus of aid for other programs, we need to create a strategic budget plan that is focused on operational budget, cash budget, and capital budget. Now, financial resources are going to be based on the organization's operational budget. The revenue generated to balance expenses need resources for effective delivery service. Right now, we cannot do that because of the misappropriation of funds, as I listed below. So, we must obtain a corporate accounting firm to analyze where the organization stands in regards to financial revenue and institute cuts of programs and unneeded expenditures based on their report. Now, after we receive the history of our budget plan and finances, we need to determine what needs to be eliminated. We need to eliminate any programs that is orchestrated by other healthcare agencies. And presently, because we have no local and state aid, no money coming through, we need to cease the request for local and state aid and grants in order to control overspending in our department, so we are able to operate with a sufficient budget. In regards to cash budget, we have a $2 million is almost deleted. Presently, we need to borrow money from a financial institution to make payroll. We need to ask for a 6-month probationary period to continue to obtain local and state aid so we can be able to build up our cash revenue and create a cash budget to pay bills and paychecks to our staffers. Now, the capital budget must remain separate from the organization's operation. Capital budget for furnishings can never exceed $500. That is our limit until we can get our budget in place. Budget managers will project the capital needs for each of their departments. All requests must be scrutinized based on Department of Finances, and financial approval is the executive director's until further notice. So I will be controlling any requests for money, aid, and grants until further notice, until we can get a substantial fiscal year plan that is consistent and effective. There might be a little bit of changes along the way. Now, the implementation of this fiscal budget plan will ensure that HCB has a yearly surplus, which the budget plan clearly expresses the intentions, expectations, and actions of HCB in order for the organization to reach its financial goals each year. Meeting these goals will ensure that every department in the organization have a quarterly surplus each year. So by making sure every department have a quarterly surplus each year, it will ensure that we, number one, stay on budget, that there's no unnecessary spending. If there is, each manager must provide me with a memo to why they went over budget. But before they go over budget, they need to come up with a budget plan for each of their departments so that we can decide what the operational budget is going to be and whether it's satisfactory in association to our new mission and vision. Now, as you can see, I presented somewhat of a budget plan, and in this budget plan, I explained to what the problems we are truly facing, or pretty much a breakdown of what we're facing in regards to intervention programs and services, why HCB is in a financial and the financial state is in, why we have such a poor infrastructure, and these are the issues that you see before you. Now, in order to get our company back where it should be, where I know it can be, we need a capital budget needed to pay for our consultants. And that's where it goes. We won't have to borrow money from a financial institution. We have a lack of training and strategy will force loss of our accreditation. So consultants will help get our staff back on track so that they can meet accreditation and our company meet accreditation. Health organization without operation, cash, and capital budget, pretty much you cannot function. So we need to get back on track and get our organization back on track in regards to what we were meant to do.